Up to 30% of inpatients have diabetes, often as a secondary diagnosis. Glycemic control is therefore a challenge in all wards. There is evidence that good glycemic control during hospitalization can prevent complications. Unfortunately, blood glucose targets are often not met, as this is difficult to achieve, especially during the inpatient stay, for a variety of reasons.
That is why we have developed GlucoTab. GlucoTab is a software system for the digitalization of the entire blood glucose management process. It provides decision support for both physicians and caregivers. This includes supporting the workflows. The display of open tasks, for example, helps to process all relevant activities on the ward in a structured manner.
GlucoTab uses algorithms for automated insulin dosing, which are evidence-based and adapt to the individual insulin needs of the patient. These algorithms react flexibly to nutrition and other influencing factors, and they suggest a dose titration from day to day depending on the blood glucose course.
So, GlucoTab directly supports therapy and is therefore certified as a Class 2A medical device. When diabetes therapy is necessary for a newly admitted patient, blood glucose lowering therapy is initially prescribed by a physician. Here, the physician chooses a basal bolus insulin therapy using the GlucoTab algorithm. In the next step, the daily insulin requirement is determined. Depending on whether previous insulin therapy is already known, different variants are available for this. The allocation to the planned doses for the long-acting and short-acting insulin then takes place automatically. The second key parameter for controlling the therapy is insulin sensitivity, which can be used to determine how much additional corrective insulin will be calculated later for high blood glucose values. After confirmation of the prescription, tasks for the nursing staff are immediately active. Blood glucose measurements are performed by nurses before the main meals. Then it is entered whether the patient will eat a meal. The dose suggestion calculated by GlucoTab automatically takes into account the current blood glucose value, whether the patient is fasting, and if necessary, any insulin that is still effective from a previous administration. After the insulin has been given, the administration is confirmed and the open tasks are completed for this time of day. Once a day, the patient's insulin requirement is reassessed. GlucoTab suggests a new daily dose based on the course of the therapy up to this point, which is confirmed by the medical staff.
GlucoTab supports different types of therapy for different requirements. In addition to basal bolus therapy, an algorithm-supported basal insulin therapy can be selected, which allows for varying therapy intensity, especially for geriatric patients, depending on their health status. Of course, it is also possible to use GlucoTab with a purely physician-guided therapy. There are specific functions such as ordering a supplemental insulin sliding scale or a bolus calculator for type 1 diabetes that can facilitate therapy. This enables diabetes-specific prescribing and individualized dose calculation. For an intravenous insulin infusion, the flow rate of insulin can be suggested based on a prescribed regimen, depending on the blood glucose level.
The GlucoTab technology is designed for use in the hospital setting. It can be fully integrated with electronic medical record and medication systems. Through interfaces, data, such as laboratory values or patient transfers, can be synchronized. All data are stored and processed on a central server within the hospital infrastructure. For facilities where an electronic medication system is already in use, prescriptions and medication administrations can be transmitted from GlucoTab to the medication system in a structured way.
The software can be accessed by the users on different devices. Physicians usually prefer the PC, where GlucoTab is either embedded in or linked with the electronic medical record. Nurses can use GlucoTab directly at the patient's bedside on an Android or iOS mobile tablet.
In addition, GlucoTab can also be operated as an app on Cobas Pulse, a new point-of-care blood glucose meter from Roche. Immediately after the blood glucose measurement with the device, the GlucoTab app suggests the dose for administration and supports all further activities of the nursing staff. Thus, only a single handy device is required for blood glucose measurement, dose suggestion and documentation.
We have extensively evaluated GlucoTab in several clinical trials. Very good blood glucose control was achieved without any relevant hypoglycemic events. Furthermore, the usability of GlucoTab was evaluated, and also here we received very positive feedback.
For me as a qualified nurse, GlucoTab brings a great advantage as far fewer checks with the physicians are necessary because GlucoTab always calculates a dosage suggestion that can be relied on.
In this way, both the patients benefit from better blood glucose control and the medical staff from the support provided by GlucoTab.